If I could change one thing about today's healthcare system, it would probably be the nurse to patient ratio. This has been a relevant problem on my unit recently. I know sometimes we are forced to pair patients who are very busy and critical and unstable, and we are forced to, who should be singled, and we are forced to pair them with another patient. This is not only unsafe for the patient, but it can affect the patient outcomes, patient satisfaction. It can increase their rates of morbidity or mortality. It also affects the nurses. It causes more stress on the nurses, and it can lead to nursing burnout and cause higher rates of turnover, which higher rates of turnover in a unit can also lead to its own issues. Welton 2007 states that the increasing of intensity of care due to a greater number of invasive procedures, more powerful medications, and a growing number of patients with chronic acute illness has markedly increased the intensity of nursing care needed. So we're getting sicker patients, but we're not getting the nurses and the staff to appropriately care for these sick patients. I would know that the change improved the system by examining the association between nurse workload and patient mortality and morbidity. One study found a higher prevalence of infections such as pneumonia and urinary tract infections, failure to rescue, and shock or cardiac arrest when the nurse's workload was high. A second study researched the mortality rates of surgical patients. The results were that for each additional patient a nurse was assigned, there was a 7% increase in the likelihood of dying for a patient under that nurse's care. Some legal and ethical implications of this change would include that there is little evidence that's specific to nurse to patient staffing ratios, and if it does improve the safety and quality. Welton 2007 uses the example of a study of California hospitals before and after the imposition of mandatory ratios, demonstrated an increase in cost but no improvement in quality of care. So there's really just not enough research on the topic out there. The changing nursing role in quality, patient outcomes, and reimbursement. So some studies have proven that nurses play a direct role in quality, patient outcomes, and reimbursement for organizations. Major studies have demonstrated the association of nurse staffing and patient outcomes, including lengths of stay, mortality, pressure ulcers, deep vein thrombosis, and hospital-acquired pneumonia. Regarding cost, improving nurse staffing does not completely pay for itself, although recent efforts to reduce hospital payment for poor quality may change this conclusion. The biggest cost savings has been related to increased staffing resulted from lengths of stay. Shorter stays reflect not just reductions in complications that extend stays, but the ability of nurses to do their work and coordinate the work of others in a timely and effective manner. The type of nursing care delivery model I believe will need to be in place by 2020 is the chronic care model. I believe that would be the most beneficial with the population aging. Many issues we see in our patients are exacerbations or mismanagement of chronic issues. So I think that the solution comes to managing the disease and how their daily care is delivered and kind of preventing these exacerbations or acute on chronic issues that we're seeing. The type of restructuring activities that my organization will need to be involved in will be to develop a strategic plan. The organization will develop a strategy for a foundation of future care that will allow the organization to effectively deal with the multiple factors affecting healthcare. Among them, the heightened expectations and expanding knowledge of patients and families, advances in medicine, revisions in the payer system, and tighter relationships among providers. Criteria used to evaluate the effectiveness of nursing care in the organization would be morbidity and mortality rates, length of stay, patient outcomes and satisfaction. You could use tools such as the Press Ganey survey.